Thank you for joining us today and welcome to the second Border Health Year winter webinar where we'll be discussing the winter flu vaccines. So if everybody can just keep their mics on mute and their cameras off for the time being, that would be really appreciated. You'll have a chance to ask questions at the end, or you can pop them in the chat throughout, but we will wait until the end of the session to answer them. So the session is being recorded and will be made publicly available online afterwards. So I'll now hand over to Zainab, who is a final year medical student with an interest in public health, who is currently part of the Regional Council for the British Medical Association.
Thank you. I'll just share my screen for you. Hi, my name's Zainab. I'm a final year medical student. So today I'm going to be talking to you about winter vaccinations. So to begin with, their aim is to provide a series of practical resources to enable professionals and community leaders to support their communities to improve overall health and well-being. So to begin with, I thought I'd talk to you about the history of vaccinations. This timeline from the UK Health Security Agency visualises the introduction of routine vaccination programmes. In 1796, Edward Jenner developed the first smallpox vaccine. Since then, vaccines against serious diseases such as polio have been developed. It's an achievement to say that there have been no confirmed cases of paralysis in the UK due to polio. More recently, since the introduction of the HPV vaccine to the UK's routine vaccination programme, there has been a dramatic reduction in cervical cancer in vaccinated young women in comparison to those who are not vaccinated in the population. Overall, we can see that the UK has a long history of using vaccines to save lives by preventing serious illnesses. So, what are vaccines and how do they work? So, vaccination is a method of preventing disease. Vaccines contain weakened forms of disease, so this could be the causative virus or bacteria. Your immune system creates antibodies to fight off the weakened forms of disease. Your immune system remembers these antibodies and will be ready to fight this disease if you later come into contact with it in life. So, winter vaccines. This winter, it's been predicted that there will be a higher rate of circulated COVID-19 and the influenza virus. The reason is due to rising COVID-19 rates within the population. During the lockdown, people were staying at home and social distancing, meaning that the flu virus was unable to circulate. This consequently led to the population gaining less natural immunity. So this year, to prepare for the winter season and to reduce the chance of serious illness due to flu or COVID-19, it's very important to book the relevant vaccinations. So a bit more on the flu vaccine. So influenza, also known as the flu, is a virus common in winter. It's spread through droplets that are released when an infected person coughs or sneezes. Flu vaccines are offered throughout the winter, but the best time to get your vaccine is in the autumn, before the flu starts spreading. So, who can get the free flu vaccine? So here we can see a table with those eligible as adults and those eligible as children. So from mid-October, those aged 50 and over will be eligible for a free flu vaccine. This is to ensure that the most vulnerable people in the list are able to get their flu jab earlier. Most children will receive the child flu vaccine, and that's basically a nasal spray. Some children will be offered an injection if it's more suitable for them, and that includes those with long-term health conditions. So how can we book the flu vaccine? So firstly, you can check the clinic times at your local GP surgery. or you can book an appointment with your local pharmacy. However, those who are eligible may also receive an invite to book the flu vaccine, but you don't necessarily have to wait for this invite to book. And we're currently also supporting co-administration of the flu and COVID vaccine, so that's currently in process. So, seasonal COVID-19 booster. So COVID-19 is an infectious disease caused by the SARS-CoV-2 virus. It's spread when someone with the virus breathes, speaks, coughs, or sneezes, releasing small droplets containing the virus. If you haven't had the first or second dose of the COVID-19 vaccine yet, you should have them as soon as you can. You can have your seasonal booster if it's at least 3 months since you had your previous dose. Everyone aged 5 and over is eligible for the first and second doses of the COVID-19 vaccine. So, who can get a free seasonal COVID-19 booster? So again, here's a list of everyone eligible. And as the number of COVID-19 infections increase over the winter, this booster is going to help you reduce your risk of being admitted to hospital with COVID-19. Children's vaccinations. Please check that your child's vaccinations are up to date. If you think you've missed one or more, please contact your GP to get an appointment. Our uptake for all children's vaccinations is currently below the national and regional average. Vaccinations provide a high level of protection from avoidable illnesses and make a big contribution to children having the best start in their life. COVID has had an impact on parents not being able to get their vaccinations, and we want everyone to be safe across our system. And how can you book your seasonal COVID-19 booster? So firstly, you can book a COVID-19 vaccination appointment online at a vaccination centre or at a local pharmacy. You can also find a walk-in COVID-19 vaccination centre. And you can also use the NHS website to find how best or where best to get vaccinated.
So thank you for that, Zainab. So tonight we also have Kate, Elizabeth and Fiona with us. They are colleagues from the NHS working on improving vaccination uptake in the local region. So I'll now hand over to Elizabeth, who will give us an update on their work.
Hello everyone. I'm Elizabeth and I'm one of the operations managers from the COVID programme with a focus on the engagement and the inequalities work that we undertake. So our team look at ways to provide a robust and consistent basis on the approaches of how to improve vaccine uptake of the COVID-19 vaccination. This is among the undeserved communities, and we want to maximise the benefit of the vaccination programme and address health inequalities within the undeserved communities. So we've got 10 wards within Birmingham of low uptake, and the data does show as many as 1 in 2 people living in these wards have not even had their first vaccination. We do also have a focus on and are prioritising communities within the Bangladesh, Pakistani and Black and African Caribbean cohorts, as these cohorts have shown to have lower vaccination rates. The team look at interventions to increase the vaccine uptake in minority ethnic communities, and one of our inequalities models of work, which involves supporting other organisations, particularly at health events. Research has shown the increase of vaccination rates. So this model involves us pre-visiting organisations to provide opportunities to talk to staff, service users about a variety of topics, which include COVID vaccinations, pregnancy, flu vaccine, as well as childhood IMS. We then arrange a day to come back and administer the COVID-19 vaccine where appropriate. And we've already undertook some successful projects within our programme within the undeserved communities. We also have our mobile vaccination van. We use this to also target our low uptake wards, but obviously with the colder weather upon us now, we're looking for a lot of community inside spaces to vaccinate within the community. The main point of obviously all the engagement and inequalities work that we do with the community is obviously the partnerships. So the work that we carry out with them, with community organisations and networks to look at root causes, plan the interventions to understand the causes of vaccine hesitancy, and the tools needed to support the community are very important for what we continue to build on and work within. And obviously partnerships within the community for us are very important on tackling the inequalities in the undeserved communities. So yeah, that's obviously the inequalities and engagement side. Would Kate or Fiona like to add anything clinical side or anything that you'd like to say?
Emma, is it all right if we give just a bit of an overview about where we're at in the system? Would that help?
Yeah, that sounds good.
Okay, so we've got quite a challenging target to reach as many people as we can by the middle of December, and traditionally across Birmingham and Solihull, the challenges are that we've got a really young population, one of the youngest populations in England, and that means that reaching those individuals with different types of vaccine at times of convenience and making sure that people understand how positive a vaccination programme can be for their family and give them the best start in life poses quite a challenge across a vast range of people across Birmingham and Solihull. There's about 500,000 people who are across both those geographies who are not currently vaccinated at all for COVID. So we're trying to encourage our community leaders and community supporters to try and get behind that message. We understand that people have got vaccine fatigue. They're sick of hearing about COVID, and people have sort of switched off about where we are with our immunity around that. I think what we're quite concerned about for this winter is that, as Zainab has said, we've been, protected last winter because we were shut up in our own houses and we weren't in circulation as much. We do know that we're likely to get quite a lot of high rates for flu and COVID is already on the march again this month. That compromises a lot of vulnerable people in our communities, and it spreads very quickly. So if we've got 500,000 people who are not at all vaccinated, then that's going to take hold really quickly, and the city will feel the impact of that very, very significantly. So we're working hard with all our partners, as Lizzie says, to try and just help people understand what it means to have a vaccination and what impact that can have. But for me, it's about much more than that. It's about making sure that we talk to people about their general health and well-being, and this is a big part of it, but it's not all of it. So as system partners, if we work together on that agenda, it means we can root out and start to address some of the primary prevention offers that we have available that naturally support people with their overall health and well-being. So it's not all about COVID and flu vaccinations for us. It's really about working with everybody to keep people as well as we can through what is going to be a very challenging winter with the cost of living crisis that we face, fuel poverty, all of those significant things that people take for granted, that we all probably take for granted, that other people don't have access to. So it's really important that we help you understand what messages we want to get across, but that you can convey those messages in the way that works for your communities. So rather than us conveying those messages, it's really important that we have local people to deliver a local message. Thanks.
Thank you for that, Kate. So I'd just like to open the floor up for any questions or comments that you may have. So feel free to turn your mic on or pop any questions or comments in the chat and I can read them out for you. Okay. So thank you for joining us. So we do have another pre-recorded webinar next week, and that will be on keeping safe, well and warm. And it is worth mentioning that if you are enjoying these sessions and enjoy promoting positive health and supporting your community to improve the health and well-being, and you may want to get more involved, you can volunteer to be a Border Healthier champion. So Border Healthier champions are advocates for important health messages in Birmingham, and they distribute this information into a wide range of communities and networks. So your role as a Border Healthier champion will be to share information into your communities and encourage and support health and well-being. And we support you through monthly themed webinars and tailored resource packs. So we've previously covered physical activity. In October we'll be covering cost of living, and in November we'll be covering diabetes. So if this is something that you're interested in, you can sign up today or find more information by searching Border Healthier Champions Birmingham City Council, or by clicking the link in this slide deck. So thanks once again for joining us, and we hope to see you again soon.